Stakeholders in the health sector say the cost of malaria treatment is pushing most families to economic woes, hence the use of concoctions as remedies for treating the disease. The call is part of the activities marking this year's World Malaria Day, where the government was asked to make concerted efforts towards encouraging local production of the new WHO's approved malaria vaccine. The report.
According to the 2022 WHO malaria report, Nigeria has the highest burden as 1 out of the 3 deaths from malaria globally occurs in Nigeria. These translate to 22 persons dying every hour due to malaria, an ailment which is prevalent amongst under 5 children and pregnant women, but has killed no fewer than 290,000 persons between 2020 and 2022. Despite efforts over the years, it is estimated that over 66 million cases of malaria occur annually in Nigeria. Hence, the need to not only control the spread of malaria infections, but also eradicate it completely. Stakeholders have called for increased efforts to bring malaria to zero level in Nigeria.
With the rollback malaria program and some of the policies that have been put in place, government has shown clear intent. But I think we need to also take it a notch forward in terms of that leadership and that mobilizing both all the major stakeholders within the space to continue talking about it, but also to back.
There are also calls to work on localized vaccine production with other countries, especially in the West African region, to reduce the economic cost on treatment and prevention of the disease.
The scale-up of a malaria vaccine cannot just happen until or unless we localize it and we have in-country capacity to mass produce and make it readily available. So by innovation, we not only mean innovations in the medicine or the vaccines, but also in how quickly we're able to scale that and make it available to those who deserve it, or those who would need to have it, those like pregnant or lactating mothers, infants under 5, and even adults. How do we make it available? So you're not innovating in producing a vaccine, for instance, you're innovating in the distribution, you're innovating in inventory and stock management, you're innovating in transport system and logistics to get these drugs and vaccines to the available people, you're innovating in storage facilities of the quality that we ensure that these vaccines last.
The WHO in 2021 approved a malaria vaccine for children for the first time after a pilot scheme in 3 African countries, with Ghana and now Nigeria becoming the first countries to approve a new malaria vaccine for use in children. Although undergoing clinical trials, the vaccine is for prevention of clinical malaria in children from 5 months to 36 months of age, as there are efforts to make other malaria vaccines for children available in 2024. Aisha Salihu, Trust TV News, Abuja.